Greetings everyone from the Sai Sanjeevani Children's Heart Hospital. Happy Valentine's Day. It's been an amazing week because from the 7th to the 14th of February we've been celebrating Congenital Heart Defect Awareness Week, and it's really great that we all get to celebrate Valentine's Day together. As you may be aware, congenital heart defects are the #1 birth defects worldwide, and this has been a great time to really advocate for the #1 birth defect in the world. What we know is that 1% of all children born are born with congenital heart defects. And in Fiji, that equates to about 200 children being born every year with congenital heart disease. And in the South Pacific, about 2,500 children are born every year with congenital heart disease. Now, in Fiji and the South Pacific, we do not have any local teams that can provide surgery for children with congenital heart disease, and we rely on visiting overseas teams. The sad reality is that many children in Fiji and the South Pacific are still dying from congenital heart disease. If a child was born in a developed country, they can have surgical intervention and survive and live a near normal life. However, the sad fact remains that in Fiji and in the Pacific Island countries, we do not have that luxury. The Sai Sanjeevani Children's Heart Hospital took birth because of the very fact that we lack these services here in Fiji and the Pacific. This hospital will provide all free surgeries for children with congenital heart disease in Fiji and in the South Pacific. And really, it's been such an incredible journey for all of us that have been involved in the Sai Sanjeevani Children's Heart Hospital. What we're going to do is we're going to take a little tour of the hospital. So come through. So as we enter here, we have the reception area. You can see that there are a lot of equipment here at the moment because the wards and other areas are being, equipment's being installed. We wanted to have quite a nice, spacious reception area so that as people enter, you sort of feel that you have the reassurance that you're going to get better. Of course, our mantra is love all, serve all, and that's what the Sanjeevani Children's Heart Hospital stands for as well, the elixir of life. And this hospital will give a gift of life to many, many children in the coming times. Now, we're going to go through into the hospital and take a little tour of all the different areas. Now, we're going to start off with the kitchen. So here we have our beautiful kitchen that will provide food to the children, also to the staff, and service the cafeteria. This kitchen has been designed in New Zealand, and every aspect of the kitchen has arrived from New Zealand. A lot of these things are not available in Fiji, and hence things need to be procured from overseas. It's not, you may take it for granted that hospitals in the US and other countries would have kitchens like this, but this doesn't exist in Fiji, and we're trying to do our very best for our children here in Fiji. So what we have here now as we enter, this is the Pre-Operative Ward. When the child gets admitted to hospital, if they need surgery, they'll first be admitted in the Pre-Operative Ward, and from there they'll go on to have their surgery. So you can see that things are being, the gas installation's being done, and you can see that there's lots of services that go behind every bed. Usually when a hospital's ready, you don't see all these things, but because we're in the process, you can see there's wall heads there with oxygen, air suction, the lights sort of up there. We also have an isolation room here so that if there's any child who might have any infection, they're going to be in there, and it has its own toilet and bathroom as well. So certainly we've tried to make sure that we achieve international standards. That's the gas system that you see here. This gas system has been designed in New Zealand as well. And in fact, we have biomedical engineers who've had to come from New Zealand to do the installation because we do not have these expertise in Fiji. And let's go through. We're going to let's keep walking. So you can see the corridors of the hospital. Okay, another room that we're coming through now is the laundry. Now this laundry has also been designed in New Zealand, and all the equipment here is from New Zealand. We have washers and dryers. Again, it's taken for granted that most hospitals would have these sort of standards, but not specifically in Fiji and in the South Pacific. So we've certainly tried again to ensure that we achieve international standards. So all the laundry, all the linen will be done in-house within the hospital. Okay, and we're going to continue walking. And we're coming through towards the operating theatre, which is a very critical and a very important part of the hospital, because most of the work, as you can imagine, all the surgeries are going to happen in this room here. You can see that there's some installation of some pendants that are coming through. And we have our biomedical engineer from the United States, Roy, who's installing the operating theatre at the moment. Now, the operating theatre is obviously a very complex area, requires a lot of services, and we have certainly tried to achieve international standards here as well. Most of the equipment has come through from the United States and New Zealand. As I had mentioned earlier, not all of these things are available locally. Within the next few weeks, we should complete the installation of the operating theatre, a very, very important part of the hospital where lots of children are going to be saved, many lives are going to be saved in this room. Okay, and we're going to continue walking, and another very important room in this hospital is the Cath Lab, cardiac Cath Lab. Now this Cath Lab, this room will have a Cath Lab which will do interventional procedures for children. Now what that means is that you don't necessarily have to do an open heart surgery where you have a big cut in the center of the child's heart. For certain lesions, an angiogram can be done and devices put inside the child's heart. Now what that means is that the recovery time is much faster. These children don't have a large scar as well. Now the Cath Lab has also come through from the United States, and the installation is happening at the moment. We have our biomedical engineer Roy from the United States who's doing the installation. We've also tried to have this as a larger room because we do know that in the future there will be many changes in how cardiac surgery happens, and a lot more interventional procedures may happen and robotic procedures may happen. So we've tried to have a room that is large enough that other changes could be made in the future, and that we can have other facilities added. Lots of steel up in the ceiling there so that there's reinforcement for the Cath Lab, which weighs a lot, very, very heavy piece of equipment, and the arms actually turn. And we've had to make sure that the flooring has also got enough capacity to withstand the large tons of weight that the Cath Lab actually generates. So this is the Children's Heart Hospital, and now we actually come to another very important room, another very important ward, the intensive care unit. Now the intensive care unit is the place where a child will come after surgery. So once they've had their surgery, they'll come into this room, they'll be monitored by the nurses and the doctors. Each and every bed will also have a chair for the mother. So it'll be a large chair which becomes a bed. So that once the child has had surgery, they have their mother or their caregiver who's there with them. And we know that recovery happens much faster when the mother or the primary caregiver is there with the child. So you can see that we're almost there with this ward. The monitors are being installed. Now these monitors, all these equipment has come from the United States. Again, very good equipment that can monitor the heart rate, the oxygen levels, and all sorts of parameters for a child who's had cardiac surgery. So we've also got the nurse's desk where the nurses are going to be sitting. Fairly large room, we'll have 10 beds and also an infant warmer in here. And the total number of beds that this hospital has will be 27 beds. Thank you very much. I have to go now because I have a few patients waiting. But I'd just like to say that appreciate your time, and let's all work together to save the lives of children in Fiji and in the South Pacific. Just a little quote that I can remember from Helen Keller. The best and the most beautiful things in the world cannot be seen or touched. They have to be felt with the heart. Thank you so much.